Good morning. Somewhat like Anishka's presentation yesterday, my presentation is going to be very practical in terms of our engagement with faith and society. And I want to speak from the perspective of Catholic healthcare, because one of the important ways in which the church is an evangelizing agent in our culture is through its extensive network of Catholic healthcare, Catholic hospitals, Catholic nursing homes, other Catholic healthcare services. For example, here in the western United States, we provide 60% of the acute care in Alaska, 40% of the acute care in Washington State, over 13% in California, and we have a substantial presence in Oregon, Montana, Nevada, Arizona, and Texas. So these are critically important institutions for the church. And this morning I want to address two areas where we intersect with faith and are an agent of change in terms of culture. And the first one is in the area of ministry leadership formation. In 2002, the Alliance of Catholic Healthcare, my organization, and the California Catholic Conference, Ned DeLussey's organization, convened the bishops of California and our Catholic healthcare leaders for a conference in Palo Alto to examine the challenges facing Catholic healthcare and what we might do together as Episcopal leaders and healthcare leaders to address those challenges. And one of the challenges that became an immediate priority was the urgent need to design and implement a ministry formation program for the senior leaders in our Catholic healthcare organizations. And this was necessitated by two developments. First, the fact that ever fewer women religious, the founders and the culture bearers of the Catholic mission in healthcare, were available to serve in management, governance, and sponsorship. When I joined the Catholic Health Association in 1980, 65% of Catholic hospitals were administered by a woman religious. Today, not one is in the United States, and that's across over 600 institutions across the United States. Second, while lay leaders in Catholic healthcare were technically competent, often amazingly so, for the most part they had no deep grounding in how to operate their hospitals as church ministries. And if something wasn't done to address this situation, our systems and hospitals would inevitably lose their Catholic mooring over time and become secular entities, just gravitate into secular entities with little or no connection with the church. So the bishops and healthcare leaders back in 2002 established a work group that met monthly during the next year to outline the dimensions of what lay ministry formation should encompass. We were starting de novo. We had no idea at the outset what this would entail. We did early on determine that if formation in mission and ministry was important, it had to be something more than a weekend program in personal uplifting experience. So we decided right at the outset that we had a lot to do in terms of formation, and our formation program would be a 3-year program for all senior leaders in Catholic healthcare. The first pushback came from a woman religious who said, "Oh, we can't take these very important senior executives out of Catholic healthcare because they have so much to do within their institutions." And our pushback on that was, if you don't, you're not going to have Catholic healthcare. So we're going to have to do both, and these senior executives are going to have to do both. And the most effective corporations and organizations in the United States are those that have a clear sense of mission and whose leaders understand the mission of the organization. So this became an imperative. and it became known as the Ministry Leadership Center. I appreciate being identified as the founder of the Ministry Leadership Center, but I'm not. I was just one of the animators at the outset of this. We had many, many really qualified people, including Ned, involved in the development. So in 2003, the healthcare leaders and the bishops accepted the plan, and the healthcare system CEOs agreed to fund it. And the funding wasn't inexpensive. We were talking several millions of dollars a year to do this well. A theologian with extensive healthcare experience was hired to lead it, recruit the center's staff and faculty, and flesh out its program. The center, over time, the center developed a curriculum that invites its participants to explore the culture of Catholic healthcare through 12 foundational concerns, beginning with vocation. That is, work in Catholic healthcare is not just a job, it's a calling. The second foundational concern is heritage. The very rich heritage we derived largely from the women religious who founded these institutions. The third was spirituality, and the late Andre Delbecq headed that section up, one of the fellows here at the Dominican School. Did an incredible job. Then we did response to suffering, values integration, Catholic social teaching, clinical ethics, discernment, organizational ethics, care for the poor, whole person care, and collaboration with church authorities. Every 3-year cohort ended with a bishop sitting with these senior healthcare executives, many of whom had never seen a bishop. And we had the bishop talk about the challenges he's facing in his diocese, his perception of Catholic healthcare, and they had a vigorous engagement in every single one of them. It was good for the bishops, and it was good for the healthcare leaders. Between 2004 and 2016, the Ministry Leadership Center formed more than 1,000 Catholic healthcare executives in mission and ministry. The participants learned how to integrate the 12 foundational concerns into their personal and professional lives. This wasn't just about creating better leaders for Catholic healthcare. It was about enabling people to become better people. Through an examination of the key elements of the Catholic tradition. And they not only had to integrate it into their personal lives, they had to learn how to articulate it back, and they had to learn how, in these programs, to incorporate it into the operations of their hospitals and health systems. So it got very, very practical as well. It is hard to overestimate the impact that this has had on people's lives and on our ministry. When you would go to the final session after 3 years and ask the participants in this formation program, what was the principal thing that meant so much to you in this program, or what did you think of it? They would just almost universally say, "I can't believe my healthcare system made this opportunity available to me. It has made a huge difference in my life." And then we began to see the differences back in our systems too, when they put their budgets together, when they designed programs for their communities. All of these Catholic principles came to bear on how they accomplished their work. The program became so successful, as a matter of fact, that the Hilton Foundation gave it a $1 million grant to determine how it could be adapted to other institutional ministries in the church, such as Catholic Charities, Catholic Relief Services, and, quite frankly, Catholic higher education. So that is one way in which, in a very practical way, faith is making a difference and making a difference in our culture. I had a friend, just to tell a story, I was invited to a barbecue years ago, and a Jewish family was present at this barbecue, and this Jewish fellow who taught at George Mason University saw me and knew I worked in Catholic healthcare, and he said, I need to talk to you about an experience we had. And I thought, oh my gosh, what's coming now? And he said, we took our family up to Anchorage, and then we went out into the bush. I wanted to take them out into the bush in Alaska. And my youngest daughter, got very sick and had to be medevaced back to Anchorage. And the big institution there is Providence Hospital, beautiful place. And he said, we walked in, Bill, and I saw these crucifixes. And I turned to my wife and said, we're in trouble now. He said, when we left, our experience, the way we were treated, the way my daughter was cared for, the way the staff responded to our family was incredible. And he said, I just want you to know that. It was an incredible experience. So this man looked at the cross before his experience there as an obstacle. When he left, it was no longer an obstacle. And I think that's very much, without proselytizing, a form of evangelization. In October 2015, the Alliance of Catholic Healthcare and the California Catholic Conference convened the bishops. We do this periodically every several years, this time in Burbank. And a critical issue facing these leaders was California's recent legalization of physician-assisted suicide and what they might do together to respond to it. The leaders established a working group comprised of bishops, physicians, healthcare, and diocesan leaders to develop and recommend an appropriate and effective response. As it conducted its work, the leadership group noted the following. First, public opinion polls almost universally show that upwards of 65% of U.S. voters now support legalizing physician-assisted suicide. Second, they noted a 2015 National Institute of Medicine study that revealed that the experience of dying in the United States is often characterized by fragmented care, inadequate treatment of distressing symptoms, frequent transitions among care settings, and enormous care responsibilities for families. According to this report, the current healthcare system of rendering more intensive services than are necessary and desired by patients, and the lack of coordination among programs increases risks to patients and creates avoidable burdens on them and their families. Third, the group noted that nearly every one of them knew or has heard of someone who has died badly while receiving sophisticated and expensive life-sustaining treatments in hospitals or nursing homes. Many of these people endured their final days in pain, feeling undignified and a burden to others, and their loved ones often felt lost and confused, not knowing how to get through each day or how to plan for the future. Worse still was the realization later on that much of this suffering was unnecessary. It is not surprising then, looking at these things, that fearing the possibility of dying badly in a healthcare facility, the public increasingly believes terminally ill patients should have the legal option of ending their lives. Fourth, the group noted that advances in treating disease have multiplied both the complexity and duration of family caregiving. The studies have shown that many of the people who go through this experience, especially with someone in an ICU, the after effects are similar to what we call PTSD, and I've seen this in a couple of my friends who have experienced this. The economic impact is enormous, and so it's debilitating to families as well. So the leadership group concluded that a transformation is clearly needed in the way society, not merely our healthcare system, cares for seriously ill people and supports family caregivers. The group also further concluded that the need to transform the way in which society cares for the terminally ill and supports their families requires urgent and decisive action on the part of the church. Accordingly, they recommended that the bishops and healthcare leaders focus their collective energies during the next 5 years on implementing a robust whole person care initiative to ensure that their parishioners, their patients are loved and supported, can openly talk with their spiritual leaders, clinicians, and family members about their wishes at the end of life, and have access to quality palliative care before they suffer needless medical procedures. The bishops and the healthcare leaders adopted this program on October 19th of last year, along with the following aspirational statement. As church and Catholic healthcare leaders in California, they said, we believe that physician-assisted suicide, while legal, is not yet an entrenched cultural or clinical reality. Recognizing this, we are committed to developing together and in collaboration with other leaders in the palliative care field a medical and pastoral approach to care through the end of life that provides a dignified, compassionate, and loving alternative to assisted suicide for seriously ill people and their families. Our intent is to create a church and Catholic healthcare collaborative model that serves our California parishioners and patients well, and that can be replicated by the church and Catholic healthcare leaders in other states. The California bishops and healthcare leaders believe that by caring well for the frailest and most vulnerable in their dioceses, parishes, and healthcare facilities, they can improve care for many people now and in the years to come. They can make clear that the best care possible not only includes excellent disease treatments, but also concern for a person's physical comfort and emotional and spiritual well-being. And they can raise broader cultural expectations about the kind of end-of-life care people need, people deserve, and people should be demanding. In so doing, they believe they can protect the breadth of our human endowment in ways that will be felt long into the future, and that the healthiest response to death is to love, honor, and celebrate life. Thank you.